Dear students, in today's class, we'll discuss about the role of the government in health. That is chapter number 2 of social political life. In this chapter, we'll be discussing about role of the government in maintaining public health. Before going into the details, let us know what is health. Health can be defined as our capability to remain free of illness and injuries. Health is not just about diseases. There are certain other factors which makes the government to come into the role of maintaining the health of the public. Some of them are clean drinking water, adequate food to eat, pollution-free environment, etc. People often fall ill if they do not have clean drinking water or nutritious food, if they live in polluted places, or if they are under a lot of stress. Let's discuss healthcare facilities in India. India is the fourth largest producer of medicines in the world. But India also has one of the largest population in the world, and a lot of resources and planning is required to provide good healthcare services. Many people even today don't get sufficient healthy food, clean drinking water, proper sanitation and pollution free environment. Healthcare professionals like doctors, nurses, etc. prefer to work in urban areas. Hence, the village population either don't get good healthcare or have to travel long distances for getting quality medical treatments. India also gets a lot of medical tourists for their treatments, which results in further shortages of medical services to the poor. Why does India attract a large number of medical tourists? Do you know that? Advanced facilities, skilled doctors, and low cost treatment made India a popular hub of medical tourism, which encourage a large number of foreign patients every year. In order to prevent and treat illness, we need proper healthcare facilities such as health centers, hospitals, test laboratories, ambulance services, blood banks, etc. Though our country has money, knowledge, and people with experience, even then, people are not provided with proper healthcare facilities. Healthcare services. When we talk about the healthcare system, there are two systems that exist parallel in the society. First is public healthcare system and another one is the private healthcare system. Public healthcare system is a network of health centers and hospitals run by the government. These are available both in rural and urban areas. At the village level, there is a nurse and a village health worker trained in dealing with common illness as they work under the supervision of doctors at the PHCs, that is primary health center. At the district level, the district hospital supervises health centers. Large cities have many general and specialized government hospitals. Public healthcare system is much affordable as they provide services either free of cost or at very low cost. Due to the affordability of a government hospital, there is high rush in the OPD. OPD are the outpatient department. It is a department where the patient is primarily seen, and then if need arises, he or she is shifted to the ward. Public healthcare services are known as public because it has to provide healthcare to all the citizens, and also because the public health sectors get their funds from the taxes paid by the general public. So, it is the responsibility of the government to assure that it prevents spread of diseases such as TB, malaria, jaundice, etc., which can cause illness to large public. Now, the next is private healthcare system. Private healthcare system are those which are privately owned and not controlled by the government. A large number of private healthcare facilities exist in our country as many doctors run their own private clinics. There are registered medical practitioners called as RMP in rural areas and large number of doctors providing specialized services in urban areas. Urban areas also have hospitals and nursing homes that are privately owned. There are many laboratories which provide special facilities like X-ray, ultrasound, and medical shops from where we can buy medicines. Patients have to pay a lot of money for their treatment in private hospitals. Today, the presence of private facilities can be seen all around. There are large companies that run hospitals, and some are also engaged in manufacturing and selling medicines. Nowadays, medical shops are found in every corner of the country. So, I hope in today's session you have understood the role of government in healthcare of citizens. Leftover topics will be covered in the next video. Thank you.